What does a biopsy tell us about malignant bone tumors? Imagine trying to solve a mystery about a suspicious lump in the bone. A biopsy is like gathering crucial clues to understand what's really going on inside that lump. It is the only way to definitively tell if a bone tumor is malignant, which means cancerous, or benign, which means non-cancerous. When doctors suspect a bone tumor based on symptoms and imaging scans, they often recommend a biopsy to get a closer look at the tissue. This process involves taking a small sample of the tumor tissue, either with a needle guided by imaging technology like computed tomography or through a small surgical procedure. The goal is to examine the tissue under a microscope and perform additional tests to understand the tumor better. A biopsy helps confirm whether the lesion is malignant or benign. It also identifies the specific type of malignant bone tumor, such as osteosarcoma, Ewing sarcoma, or chondrosarcoma. Knowing the exact type is important because each tumor responds differently to treatments. The biopsy also reveals how aggressive the tumor is by assessing its histological grade. A high-grade tumor looks more abnormal and tends to grow faster, which can influence how intensive the treatment needs to be. In addition, molecular and genetic studies on the tissue can uncover specific mutations or markers. These details can sometimes help guide targeted therapies or determine eligibility for clinical trials. There are different ways to perform a biopsy. A needle biopsy, often guided by imaging, is minimally invasive and usually done on accessible lesions. An open surgical biopsy involves making a small incision to remove a larger tissue sample, which can provide more information. The choice depends on the location and size of the tumor, as well as the need for precise diagnosis. Proper planning of the biopsy is essential to avoid spreading tumor cells along the biopsy tract and to preserve options for limb-sparing surgery later on. The accuracy of a biopsy is generally high, especially when performed by experienced specialists. It is especially reliable for confirming malignancy in patients with known primary cancers that have spread to the bone. However, sometimes initial biopsy results may be inconclusive or indeterminate, requiring additional sampling or a more extensive surgical biopsy. Small samples can sometimes miss parts of the tumor, especially in benign bone tumors, which may need more tissue for a definitive diagnosis. The information gained from a biopsy is vital. It confirms whether the lesion is cancerous, identifies the specific tumor type, and determines how aggressive it is. It can also reveal genetic or molecular features that might influence treatment options. Importantly, it helps distinguish primary bone cancers from metastases, which are tumors that have spread from other parts of the body. This distinction is crucial because primary bone tumors and metastatic tumors are treated differently. The results of the biopsy directly impact treatment plans. If the tumor is confirmed to be malignant, doctors can decide whether surgery, chemotherapy, radiation therapy, or a combination is needed. Accurate diagnosis helps avoid unnecessary treatments and ensures the patient receives the most appropriate care. It also helps plan the surgical approach, whether limb-sparing surgery or amputation, and guides the overall prognosis. While biopsies are generally safe, they do carry some risks. These include bleeding, infection, damage to surrounding tissues, and very rarely spreading tumor cells along the biopsy tract. That's why it is important that experienced specialists perform the procedure and carefully plan the biopsy site. Proper technique and interpretation are essential to avoid misdiagnosis and ensure the best possible outcome. In summary, a biopsy is a cornerstone in diagnosing malignant bone tumors. It provides definitive evidence of cancer, identifies the tumor type and grade, and offers genetic insights that help tailor treatment. When performed correctly, it plays a key role in guiding effective, personalized care for patients facing bone cancer. Always remember to consult healthcare professionals for individual diagnosis and treatment options, as each case can be unique.